All right. Welcome, everyone. Sherry Ferguson here with Portland Connections with the Portland Chamber of Commerce. And we are discussing now still on COVID 19. We're trying to keep everybody informed and talk to people that are in the trenches. And today we have with us Chief Greg Miller. Hi, Chief Miller. How are you?
Good. How are you all?
We're doing good. As you know, we talked about I am on vacation, but I'm still, I know people have really enjoyed getting updates and finding out what's going on. So just because I went on vacation, I wanted to keep everybody informed and know what, I mean, things are still changing rapidly, but I'm hoping that they're going in the other direction. Um, so let's talk a little bit about how Sumner County is doing since the governor opened up the some of the businesses.
Actually, I feel like from our perspective, that's going pretty good. There are a lot of people who were out and about before the restrictions were lifted. They had to work. We saw people in the grocery stores. We saw people in the big box stores. And then since things have opened up, some practices have not changed. Some people still do not feel comfortable going out. And we encourage them and then stay home. If you can stay home, and continue to exercise. We all look at things a little bit different now than we did 2.5 months ago. So we're more conscientious to touching that buggy. We're more conscientious to touching our faces. We wash our hands more. We have invested more in hand sanitizer. And I think those things are truly helping. That, along with the masks, and really paying attention to who we let around those that are medically fragile.
Well, I know that some too have not opened. Some of these businesses that are able to open have still chosen to stay closed. And I think there's a couple of reasons for that. I think number one, they want to be safe, but I also think sometimes it's not profitable to open at a 50% of their dining area if that's what they're doing and things like that. So do you think that we will see this gradually open up and people are getting more comfortable with it? What are your thoughts on that?
That's exactly what will happen. And if I encourage everyone to go on Tennessee.gov and look at Governor Lee's reopening Tennessee plan, which is in a few phases. And as long as there is not a significant spike to the numbers, we're going to see some increase. And I want everybody to understand that you can't put everybody back out and us be coming in contact with more and more people than we would if we were at home and not have an increase in the numbers. But as long as we don't have those tall peak spikes that exceed the daily spikes that we may have had, let's say somewhere around the last week of March, first week of April, then we're going to be okay. But you're exactly right, Sherry. Some of these restaurants, since they were allowed to do a takeout business, and the state also allowed them to start doing takeout alcohol, that's been kind of a saving grace for a lot of these restaurants. So they've realized, hey, as long as we can pay the bills and pay a few staff members doing that, it's hard for some restaurants to be able to limit to 50% of their capacity, especially your small little bistros that may only have room for 20 people in the first place.
Right. I think that has a lot to do with it. I think people are still a little apprehensive of going to dinner. I think that you have some that are going to go out no matter what, and then you have those that are going to be more cautious. I do. You did mention numbers going up, and let's talk a little bit about testing because that's increased as well. I know the first numbers that I heard from the Sunday testing was almost 1,000 or right at 1,000 on that Sunday drive-through testing. So where are we, and how many are we testing in a week, and how is that playing out?
Well, that very first drive-through testing that the health department conducted at Gallatin High School there were over 1,200 people that tested at that one. Then they did it again weekend before last, and there were approximately 700 that came through that testing. But from the beginning, back in March till now, there have been over 6,200 people tested in Sumner County. And then our numbers, these are fresh off the presses. So our number of positive cases today in Sumner County is 708. So we average increasing each day about 8 or 9 people. So it's just kind of been steady across through there, 7, 8, 9, and that has become that standard rate of rise. And as long as we don't see that jump up into the 20s or higher, then I think that will be good. The epidemiologist will say, hey, that's a good sign we're leveling off.
So what do you think that we can do to help keep these numbers where they are, and what are your suggestions on, because we all want to help, but I know people are getting tired of being inside, they want to get out, they want to see people. So what are your how do you want us to respond to the opening up?
It's a very good question. And I think people are tired and we're ready for this to be over with and we're ready to get back to our lives. And, it's run its course. They're tired of hearing about COVID-19. And then there's been a lot of people on social media and even in the presses that are fear-mongering. They're trying to scare the general public. They're trying to scare the elderly. And we're not trying to scare our people, whether it's the fine people of Portland or whether it's the people just anywhere in Sumner County or Tennessee. Is just let's realize that this is not going away. It's not going to just disappear until there's a vaccine. But as long as we continue to take those steps that we've started taking, that people are washing their hands more, they're wearing a mask if they're in an area that they can't social distance as much. Really protecting the elderly and the medically fragile is key. And for years we were watching around, we were touching stuff, we weren't paying attention to it. But it's that this virus is so contagious that's the difference. But I think people, especially in the past 3 or 4 weeks, have really been doing a good job. Every time I go out in the public, I see more and more people consciously social distancing. They will, instead of crowding up on you, they will back up and they will allow someone to go in front of them, whether you're in Walmart or Lowe's and some of those places. So whether they mean to or not, they're practicing some social distancing now. They're more conscientious to it. I think that's what we can do to help. And if we know of elderly people in our community and we know of people that are immunosuppressed, we've got loved ones that might be going through cancer treatment or something like that, let's help them by preventing them from having to get out. Let's call and check on them more and say, hey, I'm going to the store. Can I get something for you? That may eliminate that urge to get them out there. I heard a statistic just the other day that 52% of all of the deaths related to this have been in healthcare facilities, in nursing homes. So that's that crucial segment of our population, that demographic is very susceptible to this, and we've got to continue to protect those people.
Well, and that kind of takes us into that side of the nursing homes. We had a terrible tragedy when it got into the nursing home there in Sumner County, as massive as it did. I do know that there have been some cases in different nursing homes all across the state, but there was a huge number that you would not want to see in your county. And I mean, anytime that people are, affected in the magnitude that they were, it's something that everybody steps back and now they want to think, what should we have done? Which again, we do that with everything that we do. What should we do? And I know that they had already stopped people coming in and visiting at the nursing facilities, but how long do you think that's going to last? Because they are so fragile.
Well, looking at the governor's plan, that's going to be one of the last things. That's going to be later down the line in phase 3, phase 4, considering we're in phase 1 right now, before they will allow general public to come in and visit. I don't want people to think that they may have to wait months before they see their loved one. I'm not for sure what the timeline will be. It's going to be based on the numbers. But I'm sure there will be a way that loved ones can be able to get back in and see their family members. Something that I'm excited for is they keep telling us that some 5-minute tests are here. We've not seen them yet. We've not laid our hands on them yet. But I think that's one of the places that it needs to be, just like in a hospital. The hospitals are full of patients right now that are sick, some that are dying, but none of their family members can be there with them. And I think that's a great place for a 5-minute test to be used. And if you're a caregiver of an elderly person in the hospital or someone in the hospital, take this test real quick. Let us verify that you don't have it. Then you can come in. And I think that they could do that at the same thing at the nursing home, because there's a lot of our loved ones that are in nursing homes. They're lonely. We're missing our loved ones. And to me, that's just an easy solution, is let's get the test in the hands of the hospitals and the nursing homes so we can reunite these people with their loved ones. Because once we prove that they don't have it, to me, there's not a valid reason to keep them out.
Well, and I understand that. And it is so sad to see and you know they're lonely, because they're in there lonely when you get to come and visit them, because you don't get to visit them as often as everyone would like. But to not be able to see them for months is very difficult. And it's depressing. They get depressed, you get depressed. So again, now you have other factors going into the whole COVID issues. So on the rapid test, when do you think we might find some of those here in Sumner County?
I don't know. I don't know where they're held up at. They've talked about 45-minute tests, and they've talked about 5-minute tests. I was speaking with Hal from the health department the other day, and they've not seen either one yet. So it's not made it down to this level. And I'm not for sure that the state health department has them yet either. I've not heard in any of our meetings and our conference calls that they are touting that they've got them. So they're somewhere between A and B, and we've not seen them.
Well, hopefully it won't be long, and we will be able to get those. I know that everybody is ready to move on. And then we also have the other tests that are to test if you've had it.
Yes.
You know, and how do you think that will be used, and how will that be used to our benefit?
The antibody test is going to definitely tell if you've had it. Because there are a lot of people that think that I was really sick back in January or back in February. You know, there's rumors that, hey, this thing could have been in China a lot sooner than they claim it has. I'm not going to go into all of that. But there's a lot of people who really think, because they had a lot of those signs and symptoms. And if you have that antibody test, that's pretty definitive to say, yes, I did have it, or no, I didn't. And then if you did have it, it gives you a safety net, because the specialists are telling us that if you've had it, you cannot get it again. So that's a positive. And the second thing is, if they're wanting people who do test positive with the antibodies that they have had it, they're encouraging them to donate blood or plasma, because that's what contains the specific antibody in their immunity that you can use to make a vaccine.
So I have somebody else asking, do we have any antibody tests available? Are those available for us?
Those are available. They're available at a lot of doctors' offices. I know I'm not doing this to throw out a name, but I know specifically because I had this conversation yesterday. LaVon Clifford in her office, Encompass Health, she's got a practice in Hendersonville, and she's got another one in White House. They have it and are doing it daily. So that's just one example that I know of, because they reached out to me. We were having a conversation. So they're out there, so people can find them. And I think that they were even going to try to start allowing insurances to cover the cost of the antibody testing.
Well, talking about donating blood for those purposes, we have a big blood drive coming up on Friday all over Sumner County. And I think at one point we had talked about having some type of competition between Portland and Hendersonville and Gallatin and Whitehouse, all of them trying to see who can have the most donations throughout that time. And I know that the health department's in on that. Is there an issue with donating blood during this COVID time? What are they doing? Because I'm sure that blood donations are down now.
It's a very good thing that you all are doing this, because blood levels in the blood banks are at a critical low. And we're approaching summer. Thank God. But we're approaching summer.
Yes.
And unfortunately, during summer, our cases of trauma go up. So those are the times in which we need a lot of blood in the blood banks. People from car accidents and all different kinds of accidents who need blood. So those resources aren't there right now that are typically there, because people have been so afraid to go out and donate that they haven't. The actual act of donating blood is safe, because the healthcare provider that's going to be taking your blood, they're going to have all this PPE on, masks and eye shields and gowns and all that stuff. So you're not going to get anything from them. And all the equipment that they use is medically sterile, and it's a single use. So once they draw your blood, all of the devices, the needles and everything gets disposed of. So nothing is reused. I guarantee you they wipe the chair and they sanitize the area that you sit in between every patient. So I would consider that to be a very low risk for cross-contamination.
Is there any concern with, I don't have any symptoms, I go and donate blood, but I may have been exposed, or maybe I did have because you hear of people that didn't have any symptoms, but they have COVID-19. So will they be testing that blood when you give that blood, or is that a concern?
I'm sure that they would test it. They have certain tests that they run on the blood all the time to make sure that there's not any other type of communicable disease or anything else. So it goes through all of those processes every time.
Well, I am excited about the blood drive. It is something that, I don't mind giving blood. Some people, they give blood even if they're a little squeamish and they don't like to. I know Kristen in my office has set up her time, and they might need to be ready for her to pass out after she donates, because she's not the best at it, but she's going to do that. So I do know that the blood banks are low. I guess the other maybe positive is, with everybody staying home, hopefully the need for this blood will not be a typical summer, because we didn't have the early ball sports and early things that may have caused some of these accidents as well. But definitely the blood banks I know that are low and need to be, we need to be giving blood.
I hope that you're right. But at the same time, we all know that whenever this release comes, I almost feel like it's going to be like someone's out there waving the green flag, and here they all come, and they're ready to get out there, and they're ready to hit the swimming pools and the ball fields and get out, and the trauma incidents will return.
Well, and I also think that you have a lot of those traumas on people's own property, riding dirt bikes, riding motorcycles, and those things are still going on, because we're not social distancing from our family and our household. Right. So we're out there still doing a lot of those things. So yes, I know that the need is great. And like I say, I'm glad to be a part of it. I'm glad that the health department did. And what's very interesting is Hal had been working on this to happen, 6 months ago, before all of this. So it actually was perfect timing in having it at this time of the year.
Yes, and you're very right, because in the downtime, the little bit of downtime that I've had, some of the evenings and some of the weekends, my wife has given me this big old to-do list. And I think I've attempted or almost had near-death experience a couple of times where I might needed some of that blood, because you take a guy who's not familiar with a lot of these power tools, and all of a sudden I'm trying to do stuff that I shouldn't be doing. So,
yes. Well, and when you don't use them every day, some of those little safety features you forget. It is a hazard a lot of times at home. Somebody just mentioned that giving blood is kind of like a mini health check because they discover things as you give blood. So it's great for the community. So again,
Yes.
we're excited about that. So how about your staff? How are they doing? I know that you guys have in the beginning were exhausted, and so how are your calls and how are the mental health, I guess, of your staff?
The call volume has decreased some after that big wave back in March and April. But I couldn't be more proud of a group of EMTs and paramedics than what we have here in Sumner County. They are resilient, and they have just been troopers. They've stuck it out, and I know that it's been difficult, especially those that have small children, and we've got employees that take care of elderly parents at home, and we've provided a hotel for them that they can stay in the hotel in their days off so they didn't have to worry about taking stuff home. And it's got to be some sort of psychological toll because you're around sick people every day and you're like, oh, is this the day? And what we all started doing months ago, and we were in the command post. So we weren't out there in the field, but we still would be taking deliveries and everything else. That we were telling everybody, when you wake up in the morning, make sure you don't have a sore throat, check your temperature. Is your smelling okay? Because it affects your smell, it affects your taste. It gives you a metallic taste if you've got it. So we were all doing these self health screenings before we even put our feet on the floor. But thank you for asking for them. There, it's an honor just to be associated with this group, and I'm super proud of them. And they've worked their tails off for the citizens and the visitors of Sumner County during this time like no time ever before.
We all do think about and know that they are going through it because they are boots on the ground and the ones that are right there with it. The one thing that a lot of times with your first responder, whether it's a firefighter or whether it's the EMTs or whoever it may be, you don't think about them every day because you don't need them every day. So this time of year, during this, I feel like they're on everybody's mind because they do know that they're out there on the front lines. Not that they aren't any other day, but
sure,
they see what they're going through, and we do appreciate all of your guys at the chamber. We really think couldn't ask for, like you say, a better group with Sumner County. We just have really all the respect for your guys and gals, what all they do, and we do appreciate them as well.
I'm putting hand sanitizer on if you was wondering what I was doing. I had to
there
touch
you go.
my face. I had to touch it.
It is funny how many times a day you touch your face and you don't realize it. And especially with people with glasses, because you're always shifting your glasses, moving your glasses. But
I've always got to mess with my hair.
Well, that is something that when it looks that good, you really shouldn't have to do anything with it.
Right.
So, but what about your first responders? Have you had any positive tests, and how has that been handled?
Very early on, around the end of March, we ended up having 2 employees that became positive. And what's funny is they're that very small demographic that both of those guys had 0 symptoms. And they got tested and they came back positive. So they were quarantined for several weeks because the CDC will not allow them to come back to work in healthcare without greater than 7 days symptom free and a couple of negative tests on the screening. But that's what we did. We just removed them from frontline service, and then we replaced them with other personnel, and they were chomping at the bit because they were staying at home and wanting to be out here. As crazy as that sounds, we're the guys that us and police and fire, we're running in while everybody else is running out, and it's in our blood. You can't help it. But I guarantee you, because they called us all the time, can we come back yet? Can we come back yet? But we're blessed that we've got around 140 employees if you count full-time and part-time. And, it takes a lot of people out here to care for the 200,000 plus people that live in Sumner County. So during that entire time, we had a total of 38 employees that had to be tested. They became symptomatic. And only 2 of 38 ended up positive. The other ones, it was something else. It was a rhinovirus, or it was a common cold or something like that. And it's a blessing that out of 140, only 2 were positive. And we were happy to know that both those guys are healthy and they're back to work and they're serving the community today.
That is awesome that, again, they were symptom free. But that's also probably why they wanted to come back to work. I don't feel bad, but I can't go to work. So, well, another thing that I think has been on people's mind is it has been said that the governor released names and addresses of people to the frontline workers, the police, and the EMS of people that have tested positive. So is that something that you guys have access to? And I know that is for safety, but you may talk to the people, explain a little bit about why, because some people were apprehensive that now you have that information, but you want to address that just a little bit?
Absolutely. I'd be glad to. And that's definitely been the topic of conversation for the past 72 hours. And Governor Lee has taken some shots because of the release of that information. And the information is releasable anyway because of federally, there's the Ryan White Act from several years ago because he was an HIV patient. But very early on, there was not enough PPE to go around. So all the hospitals and everybody, we were all scrounging for the same stuff. And then all 50 states is looking for the same stuff. And there wasn't enough to go around. So they started being able to at least let us know that, hey, the address that you're going to is a suspected positive. Those screening questions that they were asking, they weren't giving out names over the radio or anything like that. They were just letting us know whether we needed to really ramp up PPE and be at a very high level, or if we could go to a minimal level that still covers it. But you know what I'm saying? There's a difference between all hands on deck versus we're going to take general precautions here. That information yielded that. So we weren't getting blasted with a bunch of people's names and addresses, basically just a note that says, hey, exercise highest precaution. This is a probable COVID-19 case.
Well, and I think that from the standpoint of you're going into these homes and it is, if you got your people, 130 people are exposed and become sick, there's nobody to go into those.
Nobody else.
So,
there's no one else. Yes, you're exactly right. And another thing is we are very strictly governed by the HIPAA laws. So no matter what we're told, even if I'm in the back of the ambulance and I'm taking care of you, Sherry, and you confide in me and you tell me medical history and anything else, that can never go outside of you and I except the other people in the care of your health. So we can't release any of that. It doesn't get distributed anywhere else. And because there are very strict penalties for that. So we're used to that. Whether it's someone that has HIV or hepatitis, or maybe it's someone that's got cancer, or maybe we just drove by and we saw that Joe had a car accident. We can't go tell everybody else that Joe had a car accident.
Right. Well, like I say, I do hope that you guys are able to stay safe. What about at one point, I know that police and fire they were responding, and they've always helped you guys a lot in a lot of these calls. And
yes.
Fire department, they sit in the truck. They don't go in unless it's a dire emergency. Is that still happening? What protocols are being taken there?
Exactly. They are still happening that way. What we've encouraged our partners in law enforcement and fire service to do is if they get on the scene before us, the first thing is try to establish verbal contact with who the patient is inside. And if the patient can get up and come outside, then you get out here in the open air, and there's a much lower risk of cross-contamination than being inside in a room and getting the droplets of spit on you and those things, not to be gross, just to be medical. And if they have to send someone in, they'll send one person in. But if they can establish contact and everybody's fine, then we don't want them to risk the exposure or to waste a precious commodity of PPE if they don't have to. And then they're just there in case we need them. And then if something happens and the patient's bad and we need an extra set of hands, they jump right in and help us just like they always have.
Well, I do know that the PPE was the huge issue before. I think that that's gotten better. You have PPE, but you're still conserving it, I'm sure.
Yeah, the Tennessee Emergency Management Agency has really helped us out. Patrick Sheehan is the director, and they've done a great job. They've got a local factory in Lebanon that has become one of the main distribution points for Middle Tennessee. But they will only give us 7 days supply at a time. So we have to be able to calculate what we call a burn rate. How fast will we burn through? What will we burn through in 7 days? And that's what we request. And all of this logistically on PPE is handled by Ken Widener with EMA. So we submit lists to him of what we're going to need for the next 7 days, and then they're able to get it. Not everything is available. We still can't get gowns. Gowns are gone. So that's one easy thing to protect all of your clothing so you don't have to wear around a pair of trousers all day long that's got a spot of blood or something on it. But for the most part, we're able to get gloves. We're able to get masks and things like that now. So it's just all of these resources were just so depleted from all over the world. Italy was grabbing them. China was grabbing them. Then New York and New Jersey, they had such a mass exposure of COVID there. They started buying up a bunch of the stuff. So then, wow, it's gone and you can't get it. And then some people are price gouging. And they've bought up a bunch of stuff. And a box of gloves you could buy yesterday, hypothetically, let's go back. A box of gloves you could buy February for $10 is like $500. It's absolutely crazy.
It is, and we're glad that you guys can be protected, and we pray for you guys every day. I know that from looking at the comments that have been made on here, you have a lot of fans out there. Everybody has been very high praise of Chief Miller here, and we do appreciate you and all the efforts that you and your guys put in there. And anything else you want to share with the community before you go?
You know, we love you guys, and you all have been sending us cards and phone calls and things like that. We feel like this, I feel like this is a calling. I'm here for a reason, and we have such love and admiration for the people in this community that's what we're here to do, is to take care of them, and just to know that the people out there are appreciative and are glad that we're here to help. That's all the thanks that we need.
Well, we do appreciate you, and the chamber will be providing the Portland Fire Department and EMS they're stationed at that station, and the police department, and all for First Responder Week. We're going to be sending food. So tomorrow at lunch, if you want a good meal, you can hop over to the Portland location. They should have some food, so don't let them tell you that they don't have it.
Well, you know how to get my attention. So.
It'll be coming from 5 chefs. We've ordered from 5 chefs to deliver food. So yeah, you need to pop in and just check on them tomorrow, I think.
Well, you tell them they need to send me a 5 chefs dessert, one of them cakes.
A cake.
Oh, I think that could cure anything.
I think so. I think maybe not good for your sugar levels, but anything else it'll cure.
No calories, no carbs. They make the best ones.
They do. Well, we do appreciate you and your guys, and if we can do anything for you, everybody remember to go out there and give blood Friday if you are able. I know everybody can't give blood, but if you can and you can get by, I think they're taking appointments to kind of help with that. Just making sure that there's not a lot of people hanging out at the same time and doing the social distancing. But First Baptist Church in Portland is where they'll be doing a blood drive on Friday. So
awesome.
Check that out.
Thank you all for that, because that helps us more than you know. It helps us help the patient.
So, all right. Well, thank you. And you guys have a good rest of the week.
Thank you all. See you guys.